Hello, I'm Dr James Blackburn. I am a pain medicine specialist and I work on the NHS at St George's Hospital in Tooting, where I'm the lead for the services there. I also work in the private hospitals nearby, which are Parkside Hospital in Wimbledon, the New Victoria Hospital in Kingston, St Anthony's Hospital in Cheam, and Sterling Health Diagnostics Centre in New Malden. I'm also the lead for development of pain services in South West London. Most of back pain can be divided into what we call mechanical low back pain, which is pain in the lower back alone, or what we might call radicular pain or nerve-related pain that radiates down the leg to the foot or below the knee. Pain that is mechanical low back pain is thought mainly to arise from muscle spasm, possibly with underlying spinal arthritis, and it's associated with various risk factors being obese, being sedentary, cigarette smoking, heavy manual work, the poor posture, using vibrating machinery such as drilling the road, and it has a psychosocial aspect as well. The radicular pain or nerve-related pain is usually caused when the nerve becomes trapped in the back by a disc prolapse or a piece of bone that may be causing it to be squeezed a bit when it's coming out of the bony part of the spine. There are a few underlying causes of low back pain which need to be kept in mind. They're unusual, but usually by ascertaining a good history from the patient, the doctor can decide whether these may be one of the causes. And they are things such as rheumatoid arthritis, which most people know they have because they have other problems. They may have a problem with a vertebral fracture, which happens as you get older. If you have a history of cancer, it could be cancer in the spine. It is rare, but it has to be kept in mind. Inflammation of the layer in front of the back, which is called the peritoneum, a condition called retroperitoneal inflammation. A genetic disorder called ankylosing spondylitis that mainly affects male patients. Unusually, a version of psoriasis where you can get psoriatic arthritis may also cause pain in the spine, and very rarely a condition called acromegalic spondylitis, which is caused by a growth hormone tumour in the brain. Generally speaking, most people who develop what we call acute low back pain, so that's of less than a couple of weeks, can get by taking anti-inflammatories or simple painkillers such as paracetamol and staying as active as possible, doing stretching exercises. After 2 weeks or so, it may well be worth seeing a doctor to maybe have some stronger medication prescribed. Once the pain has persisted for more than 3 months, it becomes chronic, and that's when specialist referral is advised. In the context of a radicular pain, as I mentioned, or nerve-related pain, with pain shooting down the leg to the foot, probably advisable to see a doctor after 2 weeks and possibly have onward referral at that point. Well, as I sort of alluded to, most acute back pain can be managed with simple analgesics or anti-inflammatories, and that's combined with just taking a walk and making sure you stay as active as you can, do short distances but keep them regular. In the longer term, back pain can be managed by staying active, making sure that you don't put on weight and stop smoking. Medication may help, but the key to it is to maintain your activity, such as you avoid a boom and bust approach, where you do too much on one day and can't do anything the next day, so you regularize your exercise tolerance. Things that can help are non-impact exercise such as stretching, yoga, Pilates, use of an exercise bike, or I particularly like to recommend a cross trainer, or just even walking, being careful with your posture. Back pain often disturbs people's sleep pattern, Taking a small amount of analgesia prior to going to bed may help. There are medications for longer term use when back pain persists for more than 3 months, one of which we use is called amitriptyline, because it can help with the pain and also help with the sleep pattern. There are other medications as well, such as gabapentin or pregabalin, which are useful for nerve-related pain. They can also help the sleep pattern. Generally, surgery is required when there is nerve-related radicular pain, so pain shooting down the leg or down the arm even, from the cervical spine, and that may be undertaken after imaging, which would usually be an MRI scan, or failing that, a CT scan, which demonstrates a surgical target, as in an area in the spine where it looks as if a nerve is being physically trapped enough to warrant being opened up under surgical conditions and having the bit of disc or bone removed that's causing the problem.